I had total knee replacement on my left knee on the 16th day of January here at the hospital. I was very, very nervous about this surgery. I came in for my pre-registration on January the 4th. Did that. Went to my class. I knew what was going to happen. I was still very, very nervous. I was scared. I came in on the appointed day, the 16th of January, went up to the 3rd floor, checked in. Within a matter of minutes, they had us back in the registration area, back where we were going to be placed in a room. I was still shaky, but when we walked through that door, my wife and I, there were employees that I had known for a long, long time. Jeanette Stein was there, Elaine Gear, and others. And they were laughing and talking with us, and the nervousness kind of dissipated, kind of went away. Within a few minutes, they had me in the little room back there. A young lady came back, and she was the RN that was going to work with me and get me ready. And got to talking with her, and I'm a part-time assistant principal at East Hardin Middle School, and she had a son at East Hardin Middle School. And I was talking to her about her son. They allowed my family to come back in that room. My wife, my son, his wife, my brother came in, my pastor came in. As they got ready to take me down to surgery, my pastor asked to have prayer, and the staff encouraged me. And we had prayer, and then away I went. And I don't remember anything much at all until recovery. I do remember waking up at one point, and they were talking to me, and I was talking back, and it's untelling what I told them. There may be secrets that have been divulged. I have no idea. They took me to the total joint replacement center. Those folks are fantastic down there. Pain, yeah, there was a little bit of pain, but it was controlled. It was a controlled pain. Therapy, they started therapy. I guess it was the following day, maybe even a little bit that first day, but certainly the following day. I wonder, why would anybody leave Hardin County to go anywhere to have any kind of procedure when we've got this facility? Particularly when it's not only the professionals. These people are your friends, in addition to being totally professional, and they want what's best for you. You won't find any place anywhere where the people want what's best for you any more than Hardin Memorial Hospital. We are so very, very fortunate to have this place available. And I just want to thank everyone who had anything to do with my care, but the care of any Hardin Countyan or any person that comes through here. You guys are fantastic, and I really appreciate each and every one of you. Thank you very, very much. Thank you.
Thank you, Gary.
Well said. Michelle, that's recorded. You can use the testimony.
Oh, we have the next commercial.
Anything else before we go to closed session?
I'd just like to echo Gary's sentiments here at the hospital. That same day I was having a procedure that I never had been put under, and I was an outpatient patient that day. And, most people there at the reception desk, they didn't know who I was, but I was a little bit nervous being put out. But once I got up on the floor, and of course, Dr. Kevin Warren was the surgeon that was doing the procedure, and I'll tell you what, you want to talk about something that was just as easy and there wasn't anything to it. If you're close to that 50-year age mark and you never had it done, I'm going to encourage you to do that.
Why are you looking at me?
Well, I know you're close to my age.
29?
40, you're either 47 or 48 today. I'm going to guess 47.
47.
Okay.
I'll call Dr. Mormon tomorrow.
if you don't have any issues, I guess you can wait till 50. But golly, when I got up on that floor, and there were so many people I knew, and my neighbor, she oversees that department. It was just like home, and I'm like Gary. I don't know why anybody would want to go anywhere else in this. I mean, facility is clean. We just so many happy people, and they make you feel at home. And the anesthesiologist, he was there, and he was talking to me, and he asked me to turn on my side. So I turned on my side, and I was talking to him, and the next thing I know, I wake up, and the nurse is down in the bed, and I said, when's this going to take place? She said, you're done. I couldn't believe it. So, but the service was great. But, more importantly, we have so many, we're just so fortunate to have so many qualified people in our facility. I really appreciate everything they did for me. And you don't have to wait till 50 to have it done. Thank you.
I just wish I was your all's age, so I had to worry about it.
If this is testimonial day, we've heard inpatient, outpatient, emergency department. My little 5-year-old granddaughter was lifeless almost, and we brought her to the emergency room. And in a matter of a short time, she had an IV and was doing quite well. Was admitted to the hospital, treated, and was back on the road to recovery and out within 24 hours. And just a wonderful experience with the emergency department.
Well, at the risk of sounding like a bunch of sick men, I too have had surgery here recently. So I have to brag on the outpatient group too. It was wonderful. I had foot surgery right after Christmas, and a great experience. And these two over here talking about how scared they were and how nervous and everything. They don't mention what the nurse told me. It could have been that happy shot they gave you that took that edge off. And that's what Nurse Libby told me. And I wasn't scared at all. It was a great experience. They were all great. And yeah, why would anybody go to war when you could come right here?